Hi guys, it's Adam here. I'm an orthopaedic surgeon. Having a knee replacement is a big decision, and you might be wondering whether you really need one. In my experience, there are four really important questions you need to answer before deciding if a knee replacement is the right thing for you. Often, when people ignore one of these, that's when things can go badly wrong. In this video, I'm going to run through these four questions which you should bear in mind when you speak to your surgeon about knee replacement. As always, this video is for information purposes only, and you should please speak to your doctor before making any decisions about your care because everyone's circumstances are different. Number one, is your pain actually coming from the knee joint? Now, this may sound like a strange question, but there are lots of structures around the knee, ligaments, tendons, muscles, nerves, and all of these can cause pain, but a knee replacement is treating pain from within your joint. Pain can be a complex problem to unpick, and you might not know this, but hip problems can also present with knee pain. And I've certainly seen many people whose main complaint is severe pain in their knee, but when they come to clinic, it turns out that the knee is okay and it's their hip which is the problem. Spine problems or a trapped nerve in your back can also cause pain around the knee. Through the history, examination, and investigations, your surgeon can make sure the target is correct. Otherwise, you may end up having major surgery and still be in pain at the end of it. Number two, is your arthritis bone on bone? The vast majority of people have a knee replacement for osteoarthritis or wear and tear of the cartilage, where it gradually gets thinner and thinner until the bone is exposed. You can see this normally on an x-ray. Because cartilage isn't seen on the x-ray, there's a gap between the bones, as you can see indicated by the green arrow here. In arthritis, this gap between the bones gets smaller as the cartilage wears out until eventually the bone is rubbing against the bone, as you can see by the red arrow. It's really important you have weight-bearing x-rays because when you're lying down, the joint isn't loaded and the arthritis may not seem as bad and it can be deceptive. If you only have mild or moderate arthritis and still have some cartilage left, the outcome of surgery is less predictable, and you should definitely make sure you try non-operative treatment, weight loss, exercise, physiotherapy, injections, and have a really careful discussion with your surgeon. Number three, are your symptoms severe enough? If you don't have severe symptoms which are impacting upon your quality of life significantly, you shouldn't be having a knee replacement. How do you know this? Well, there are several ways you can get a feel for how severe your pain is. How far can you walk? Does it wake you up at night time? How many painkillers are you needing to take? Do you need a walking aid? And how badly is it affecting your quality of life and stopping you from doing the things that you want to do? There are also formal scoring systems, such as the Oxford Knee Score, which are useful for surgeons to gain an objective measure of how bad your pain is. There's a huge difference between someone who can't sleep, is struggling with day-to-day activities, compared to someone who is coping quite well and their knee is just bothering them after they walk a few miles. You shouldn't have a knee replacement just in case your knee gets worse or to nip the pain in the bud. If you have a knee replacement when you don't really need it, you're much less likely to be satisfied afterwards. If you're having to think too much about whether your pain is bad enough, it means you're probably not quite ready to have a knee replacement yet. And number four, what's your risk? Complications can happen to anyone, even if you're completely healthy, but some things make it far more likely. In terms of surgical risks, one of the main things we worry about is infection, and things such as smoking, diabetes, ulcers, and a previous knee infection all significantly increase your risk of infection. It's really important you discuss this with your surgeon because if your knee does get infected, it can be catastrophic and may need further surgery. So you need to understand what your level of risk is and importantly, if there's anything you can do to reduce this, as it may influence your decision as to firstly whether or not you want to have a knee replacement, and secondly, if you are going to have one, when it should be done. As knee replacement is major surgery, there's also a risk of serious medical complications such as heart attack, blood clot, and stroke, which can be life-threatening. And again, it depends upon your medical background as to what your level of risk is, your cardiovascular history, respiratory history, any kidney problems, and this can vary from person to person. Depending upon your risk after speaking to your surgeon and your anaesthetist, it may affect how you feel about wanting to go ahead with surgery, so you need to have this conversation with them.